Immunotherapy, like chemotherapy, you'll use a toxic agent. It's kind of like
It's killing things.
Earth try to like kill. It'll kill healthy cells, normal cells. So you're just kind of going scorched earth, trying to kill anything you
Yeah.
can to fight the cancer. But immunotherapy is basically harnessing the body's immune system to fight cancer.
Welcome to Grow Healthy, Help People, podcast that Accordis puts out. Today we're talking with Sanjeev Kumar from the Gallbladder Cancer Foundation. Sanjeev, how's your day going?
Doing well. How about yourself?
I'm doing great. I'm in Tennessee, you're in Ohio, and you've been leading the Gallbladder Cancer Foundation for how long?
I initially incorporated the organization in 2024, but we formally launched on Biliary Tract Cancer Awareness Day on February 10th, 2025. So we actually just completed our first year of operation.
Just a
So
year.
yeah, so
That's
we're a
awesome.
baby organization.
And as you and I've gotten to know each other a little bit, your background is in biotech. So something in the healthcare or markers space or cancer space was not completely foreign to you like it might be foreign to some people. Give me a little bit of your background. What has your professional experience been leading up to this point of you leading a small nonprofit that's just getting going?
Yeah, so I guess even before my professional career, so I studied molecular and cell biology with an emphasis in immunology at UC Berkeley. So I graduated in 2010. In 2011, I started working for a company called Dendreon. So Dendreon got the first FDA approval for an autologous cellular immunotherapy called Provenge for prostate cancer, metastatic castrate-resistant prostate cancer. So I looked out like having an immunology degree and then working for the first immunotherapy approved company at Dendreon was yeah, it fit perfectly with my background. It was exciting. Like a whole new field was opening up. So Dendron was interesting because Provenge, we had to customize the treatment for each patient. So the patients would go through a leukapheresis. Their white blood cells would get removed. They would get shipped to us at the manufacturing facility. We would do our manufacturing process to basically train the cells how to fight cancer or prostate cancer, and then they would get shipped back and infused, and they would have to do that 3 times over 2 weeks over the course of a month. So a very interesting therapy, very complex logistically. So I worked for Dendreon. I initially started in cell processing or manufacturing, and then later on moved into process engineering. So I worked there for several years, about like 5 years, and then in 2017 I left to work for another biotech startup called NOLA Therapeutics, and NOLA was working on an allogeneic cell therapy. So instead of having to customize it for each patient, we would use donor cells and have like an off-the-shelf treatment that could be cryopreserved and frozen. So NOLA, I became the manager of clinical manufacturing, and I helped build out their manufacturing operations, and I was helping basically manage the phase 2 clinical trial for what was called NLA 101. And it was a CD34 expanded stem cell therapy derived from umbilical cord blood, and we were basically using it. The trial was for leukemia patients or AML patients who had chemotherapy-induced neutropenia. So initially, yeah, I was manufactured. Then I became associate director in 2018. I had my own set of health issues, so unfortunately, I had to stop working in 2018. But that's basically what my professional experience was. It was with autologous and allogeneic cell therapies.
But other than that, you've not been really doing much. Is that right? Like what you just told me makes my brain spin. That's incredible, Sanjeev. How neat that you've been involved in all of that, particularly now leading the Gallbladder Cancer Foundation. I mean, there's a direct tie there. And you mentioned to me earlier some treatments that were used even for your family. But tell me a little bit more about what immunotherapy is. Like I have a general concept, but I don't really understand. Can you give me the quick
Basically,
flyover?
immunotherapy. So right, like chemotherapy, you'll use a toxic agent, and it's kind of like
It's killing things.
Earth try to like kill. It'll kill healthy cells, normal cells. So you're just kind of going scorched earth, trying to kill anything you
Yeah.
can to fight the cancer. But immunotherapy is basically harnessing the body's immune system to fight cancer. So it's a lot more targeted, less side effects. There's different kinds. Actually, one of the most like successful drugs out there was it's Merck's Keytruda. It's called a PD-1 checkpoint inhibitor, and that it's been approved for many cancers. But basically, like for the way, so my experience was cell therapy, where we were using like autologous or not allogeneic cells, but checkpoint inhibitor immunotherapies, it'll be like a monoclonal antibody, right? So I guess the way I could say for what's the PD-1s and PD-L1s, it basically takes the brakes off of the immune system. So so you'll have like PD-L1 on the tumor cell and PD-1 on the T cell, which the T cells are what will kill the cancer. Um, and if PD-1 connects to PD-L1, it's basically like an inhibitory signal. Like the tumor is telling the T cell not to kill it. So what those PD-L1s and PD-1 checkpoint inhibitors do, they block that signaling. So they'll either bind to the T cell PD-1 or the cancer cell PD-L1. And once they bind, they block that signal, and then it basically takes the brakes off the immune system, and the T cell can kill the cancer. So
So it's almost like letting the body know these are bad cells, these are good cells. Go kill the bad
yeah,
cells.
exactly. Yeah.
Don't believe them telling you they're good cells. They're actually bad
Exactly.
cells. Go
Yeah,
kill
yeah.
these.
Because that's the tricky part of cancer, right? It's your body's not trained to attack itself. It's your own cells. So that's why the PD-1s and the checkpoint inhibitors have been huge. But the thing is, like, it works extremely well in certain subtypes of patients, like what I was telling you about earlier. But yeah, it's amazing, and you'll see like there's like even next gen stuff. So like people are going after different cell types, like NK cells, or most of the work has been focused on like T cells. There's CAR T cells out there where they'll like genetically engineer a T cell and put a genetic construct in it, and that's been amazing for like leukemias, lymphomas. So it's a very exciting field.
How neat. Do you hope to get back into that field, or do you think, oh, those days are kind of behind me now?
I'm not sure yet. Yeah, I mean, I've been enjoying the nonprofit side. It's been interesting going from industry to the nonprofit sector. But
Yeah.
yeah,
So
no,
let's
so
talk.
far I've been enjoying the nonprofit side.
Let's talk about that foundation. So you incorporated the foundation.
Yeah,
You've done the 1023. You've walked through the process of getting all the nonprofit approvals and that sort of thing from the IRS.
yeah,
You've gone from in most of the businesses you've been in, maybe they were small, but they were very complex. And now you're running a small, small and growing in impact, growing in revenue, growing in board members, growing in all areas. Nonprofit. How has that big shift been? I mean, it's a pretty significant shift from high tech to starting a nonprofit.
yeah. It's been very, very different. I think the main thing is like the nice thing about being small is just like how agile you can be. Like if I like a simple thing, like if I need to update something on the website, like I can go and do that in like 5 minutes versus like getting at a like yeah, I was working with a certain company to get us added to their website, and I think it just happened, but I put that request in like maybe a year ago, so like it took a long time to go through the chains and get everything done on there. But yeah, it's definitely nice being able to be agile, and it's different, right? So I come from industry. I've worked for both a public lead traded company and a private company, and a lot of it, yeah, right. It's you're accountable to your shareholders. You're worried about quarterly metrics, and the nonprofit side. It's interesting because the way I think about it more, it's like the donors and the patients and caregivers are the shareholders. So like I'm accountable to them. So yeah, it's interesting. I try to use some of like my lean manufacturing and like continuous improvement mindset to bring to the nonprofit side, but it is very different.
Yeah. So tell us how you got involved in gallbladder cancer. What was your journey there?
Yeah, so my mom was diagnosed with stage 4 gallbladder cancer in November 2022. Leading up to it, what do you call it? Yeah, I mean, she had a pretty healthy lifestyle, right? Didn't smoke, didn't drink, was vegetarian most of the time. But like leading up to August, like in that time frame, 2022, leading up to it, she just had severe loss of appetite, pain in her upper right abdomen, bloating, and then just losing weight and just not feeling well, right? Like my we're Indian, right? So she can't really start her day without drinking her cup of chai, and she'd probably drink like
Yeah.
maybe 3 cups of chai throughout the day. And like during that time frame, she just stopped drinking tea. So that was probably the biggest red flag. But yeah, basically, I took her in to her primary care. They did, and they scheduled her for an ultrasound. We found out that her gallbladder was full of stones and sludge. But it said the walls of the gallbladder were normal. So that first ultrasound didn't detect anything. And the primary care was saying, well, a lot of times people leave it out unless it's causing something. We were like, no, just schedule this for a surgeon. Let's get this out and see if that helps her. They initially sent us to the wrong surgeon. So there was a series of delays. Like I was waiting for them to schedule, and then they scheduled us with someone that doesn't have office hours. So they said, "Oh, call back." There was a back and forth, and eventually, after a series of delays in November, it was like the day before Thanksgiving, my mom was in really severe pain. So I was like, all right, I'm just going to take you to the emergency room because this is taking too long and maybe they can do something. So we took her to the emergency room. They did their own ultrasound, but they detected a mass on her gallbladder, which that blindsided us because we're like, well, we just did an ultrasound and it said it was fine. And they followed up with a CT scan and it detected about like a 9.3 centimeter mass on her gallbladder. So yeah, the thought of gallbladder cancer up until that point, like never crossed my mind. Like I worked in the cancer immunotherapy field and I'm familiar with a lot of different types of cancers, but I've never even thought of gallbladder cancer. So, they took a biopsy, we got the results about I think it was like 2 or 3 weeks later. And, it came back, poorly differentiated cells. So it confirmed cancer. And then they were trying to get us referred to an oncologist. But in early December, my mom started noticing she had like blood in her stool. So I took her back to the emergency room. And this time, so they did the colonoscopy, and this was around December 8th. So she was in the hospital. I talked to the hospitalist, and they said, well, they talked to the surgical oncologist, and he's saying that the mass, because that 9.7 mass on her gallbladder, it also looked like it was invading the liver. So they were saying because of the size, and there was some suspected metastatic disease. So because of that, they were saying, well, she's not a candidate for surgery. Like the mass is too large. We would want to try to shrink it first and then maybe attempt surgery. But a lot of times if it's already spread, they won't do surgery, right? But then an hour later, like I had that phone call around like 3 o'clock on December 8th of 2022. And then an hour later, I got a call saying like she needs to get emergency surgery because they got her colonoscopy results. And basically a section of her colon, like the hepatic flexure, like 95% of it was blocked because the tumor had invaded her colon too. So basically her intestines were at risk of rupturing because of that block.
Yeah. Is emergency surgery at that point.
Exactly. So and then the surgical oncologist was like, well, if we're going to do surgery anyway, I'll try to take out as much as I can. So took out her gallbladder, resected her liver, took out lymph nodes, and then her ascending colon was removed. So massive surgery.
I'm so sorry.
Yeah. But she, what do you call that? But because I worked in biotech, I was familiar with biomarker testing. So as soon as that surgery was done, like that same day when I talked to the surgical oncologist after surgery, I said, like, number one, I just asked how the surgery went and how she's doing. And then number two is like, can we send these samples out for biomarker testing? Because I wanted to know if there's a specific mutation we can target. And we got very lucky. We got the results later on, and we found out she was MSI high, or what's called high microsatellite instability, with an extremely high tumor mutational burden. So essentially, your tumor was just highly mutated because of that mutation. There's these what are called mismatch repair proteins. Usually, your body, if there's mistakes in your DNA, those mismatch repair proteins will correct it. But she has a mutation in one of those, or one or two of those proteins. So her cancer cell was not good at correcting those mistakes. So it just led to a whole bunch of mutations. And basically, patients who are MSI high tend to respond well to those checkpoint inhibitor immunotherapies I was talking about earlier. Because it's so mutated, it's easier for the body to recognize the cell as foreign. So when you take the brakes off the immune system, these patients tend to respond really, really well. So we put her on a checkpoint inhibitor immunotherapy. It was Imfinzi or durvalumab. And she started that, and it was a chemoimmunotherapy combo because her biomarker testing also showed that she had what's called a BRCA1 mutation. So you might hear that sometimes in like breast cancer and stuff, but patients who have that may respond well to what's called like the platinum-based chemotherapies, so like cisplatin. So she, around that time, we started her on gemcitabine, cisplatin, which were the two chemo agents, and then Imfinzi or durvalumab for the immunotherapy. So we got very lucky. Like out of her biomarker testing results, she had like positive biomarkers for 2 out of the 3 agents she was going to start. So, and I guess one thing I forgot to mention too is in January when we did her first PET scan. Like, remember that big surgery I mentioned?
Yeah. Which is in December, right?
December, yeah. And the pathology said like margins were clear, which is what you want to hear. Basically, like they got all the tumor essentially right, and margins were clear. But then in January when we did the first PET scan, like the cancer grew back on her liver and spread to her lungs. So it was just amazing how aggressive, or shocking, I guess, how aggressive the cancer was. But she started treatment in February, and then over the course of the year, She basically became in complete remission by September of 2023, and now
By her
she's
own body attacking the cancer cells,
exactly, yeah.
and some chemo, but mostly through the
The immunotherapy did
immunotherapy.
the heavy lifting, yeah. And that MSI high for biliary tract cancers, there's about like a 1 to 3% chance of having that mutation. So she got extremely lucky. Um,
Fascinating. And what was the surgeon thinking? The surgeon's like, I'm going to come in and do surgery on this lady, and her son's here beside it. And then you start talking, and the surgeon goes, "Okay, this guy knows what he's talking about. This, you happen to be an expert in what your mom needed, which is
yeah,
incredible.
yeah.
How
So
fortunate."
yeah, we were very lucky that I had that background. And but then I mean, the main thing is helping her through. So she was in complete remission September 23. She continues to get Imfinzi or durvalumab every 4 weeks just as maintenance. We were just at Ohio State yesterday, so she just had her dose yesterday. But helping her through her journey, I realized there weren't many resources of support out there for gallbladder cancer patients. I was surprised that gallbladder cancer specific nonprofit didn't exist. Closest thing I could find was the Cholangiocarcinoma Foundation, which is for bile duct cancer, so it's closely related. So yeah, I was amazed at the work that Stacy Lindsay and her team have done at the Cholangiocarcinoma Foundation, and wanted to emulate that for gallbladder cancer. So I didn't want gallbladder cancer to get left behind. Like CCF has done a lot of work progressing the field for cholangiocarcinoma. So yeah, I mean, I was surprised that nothing existed, so I decided to just start up the organization.
That's great. So tell me more about the specific mission. Like, what are the programs you're running? What is the goal? Is it awareness? Is it treatment processes? Is it support with people that have been diagnosed? Like, what is your focus?
Yeah, it's basically all that. So the mission essentially is to provide resources and support to gallbladder cancer patients and caregivers.
Yeah,
As a caregiver myself, like I want to make sure caregivers were part of the mission as well,
yeah.
and as well as raise funds for gallbladder cancer research in order to develop like more efficacious treatments with the hope of finding cures for
Okay.
gallbladder cancer. So that's essentially the mission. But we have a series of programs. Yeah, we actually got a lot done in our first
Tell us
year.
about
So
tell us about the main two, couple of programs that you're running right now. What you see the most impact coming from?
yeah, so one of the I basically had it broken up in different phases, but like for phase one, it was eventually my goal was to get the website live. So our website's just gallbladdercancer.org, and some of the partnerships we have. So the main thing was like we have a newly diagnosed section and resources sections. So just providing the resources for patients and caregivers. There's support groups we run. So there's patient support groups, caregiver support groups, and bereaved support groups on now they're on Saturdays. But so we have that available for the community so patients can connect with each other and support each other. And then recently we just launched a partnership with Citizen Health. So they have a program where they're focusing on they're building out their AI advocate platform. So a big thing Citizen does, or I guess two problems, is patients is trying to. And the goal of the project is to engage patients in their health. Like I used to go through my mom's medical record, or I still do. Like I keep a close eye on her medical records, I review them, and then have any conversations with oncologists. But number one, requesting your medical records can be a pain. And then there's so many different providers you may see, and it's scattered. So Citizen will collect and organize the medical records into a single secure location, and you could share those with caregivers, family members, or if you're getting a second opinion, you just provide a link and it gives access to your medical records. And then you can also share them with researchers as well, like the medical records. And that's de-identified, so it's not the
So you
patient
can click a
information.
box and say, "Share my information for research
Yeah,
purposes."
you have to opt in. Like by default, it's not opted in, so you have to opt into it to share those de-identified records. So they're anonymous, but that can help. Those medical records can be very powerful for progressing research. But then the big thing Citizens doing right now is their AI advocate platform. So number one, getting your medical records is a pain, but number two is understanding your medical records. So they're developing like a specific AI model that and there's guardrails on it. So it's not going to give you a specific treatment or a diagnosis. It'll just help you understand, or if you have questions about your medical records. Like when I used it, my mom's like CA19-9 level was trending up a little bit. So I just said, what were her CA19 levels over the past 6 months? And it goes through and pulls all that data. So the Citizen app, you can have a recording for the patient side. Exactly. So you can focus more on that, and then if there's anything you need to remember, that'll be tied into your Citizen account as well. And the other thing too that's nice is what we're trying to focus on is what's quote unquote the Facebook problem. So a lot of the support groups and stuff you'll have right now are these Facebook pages. I mean, they're a good resource, but there's a big issue with like bots and scammers and just a lot of bad information on there. So one thing Citizens working towards is trying to address this problem is to have like on the Citizen platform, you would have a medically verified community of patients, and you can ask questions to each other, push questions out to the community. Eventually, the medical records of everyone's medical records will be connected. So if you want to ask a question to like the cohort, you can ask the AI a question about the cohort. Like if you're dealing with a certain side effect, it can check all the medical records against that. So they're working on some innovative stuff. And then a couple other things we have is we're supporting a genome-wide association study with Mayo Clinic. So we're helping to recruit patients into their study. They're looking for gallbladder cancer patients and healthy volunteers. And it's just a blood draw, and they'll do a genomic analysis to help basically better understand the disease and work towards better treatments.
And if people wanted to help with that, how could they be a healthy sample
Yeah,
to be
yeah. So the
involved?
same thing, like on our website, there's a GWAS study. There should be a link in the top. And basically, you just fill out the form. That gets sent directly to Mayo Clinic, and Mayo Clinic will reach out with information to ship the kit to the house. But there's no cost. Like they ship the kit to the house. You just either take it when you get a blood draw or your provider, and then just ship it back to them. So all the label and everything's in the box.
How cool, man! You've been getting after it for the last year and a half. There's a lot of moving pieces here. So where do you hope the foundation, the Gallbladder Cancer Foundation, is in 3 years?
Yeah, so the way I had it broken up into phases. Oh, I guess one thing too, I just want to mention real quick about our last partner is Biomarker Help. So that's created by Matt Reedy. Initially, he created a company called Genomic Focus, and now he's kind of upgraded it to Biomarker Health. But basically, Matt had his own journey with. He has the same mutation that my mom had, so he understood like how important biomarker testing is for patients. So Matt provides a free service through Biomarker Help where you can upload your biomarker report, and it'll get you matched to clinical trials based off of your biomarker, specific biomarker. And the neat thing he has now is there's a connect feature where you can connect to other patients with your same biomarkers. So that's the last partner we have. Another free service that's a good tool for patients.
How cool!
Yeah,
Fascinating.
yeah.
So
But
back to that question: where do
okay.
you hope you are in 3 years?
Yeah. So right now I had it broken up into phases. So like phase one was to get the website launched, get the resources out there, and really
Yeah,
focus on trying to build the community first. Um, Building the community part is very challenging with how rare this disease is.
yeah.
Um,
What are the percentages of this disease? Is it
yeah,
point
so
zero zero one or like what are the
it's about like
numbers?
one point in the United States. It's about like 1.57 per 100,000. But basically, there's about 5 to 6,000 gallbladder cancer patients in the United States
Okay,
that may be diagnosed annually. To put that in perspective, like pancreatic cancer is a very rare cancer, and that's about like 67 to 68,000. So even compared to that, we're only about five to
you're
six.
yeah, you're 10%
Yeah,
of that, less than 10% of that.
yeah,
Yeah,
and it's just as aggressive as pancreatic cancer.
really.
Very, yeah, patients. I mean, we've had patients in the community, like from diagnosis. I've seen someone's mom pass away in 3 weeks, 2 months, 3 months,
Wow.
9 months. So, yeah, it's an extremely aggressive cancer. But basically, yeah, right. Trying to build a community is challenging because it's hard to build a community. Number one, with how rare it is, but then once you find someone, you're kind of losing your community just as fast as you're trying to build it. So it's been
Yeah.
challenging, but we're trying to do our best to support the patients however we can.
Goodness.
Um,
So from your mother's first onset of symptoms until her surgery, are you thinking that the cancer grew within 2 or 3 months from,
I
or
don't think
is that too
so.
hard to
I
estimate?
think that first ultrasound just missed it. It must have been growing prior to that, but it was shocking just how fast it grew back from December to January. And because that one, it was fine, and then her liver was clear, and then there was like I think it was like a 3 point something centimeter mass on her liver, and then it spread to her lungs. So it was just extremely fast, but yeah, it just accelerates. But yeah, leading up to it, it's hard to know exactly how long it was there.
As we're kind of wrapping up here, you're leading a nonprofit now, which means you wear all of the hats. What are some of the areas that you feel like are hard to lead as a now single person? You have a board, but single person, one individual leading a small organization. You said growing the outreach and growing the members or the impact list is a difficult thing. What are some other challenges
Yeah,
you
yeah. Or
have?
I guess I forgot to give you the full picture. So yeah, phase one, I
Oh,
was
yeah.
telling you about getting the research building community. Phase two is to focus more on larger scale national fundraising
Hmm.
and industry grants and industry partnerships. Phase three is to eventually become a grant maker ourselves and to fund research. So that long term vision is to fund research. Yeah, that's the end goal. But yeah, I mean, it is challenging. Like you said, I have worked in a biotech startup, so it is kind of similar, like having to wear a lot of different hats. So I was already kind of used to that. But yeah, it is different now. So yeah, I have a board of directors. One of my goals for this year is to expand the board because essentially initially it was just two of my close friends and my brother that helped me start the organization. So and then later on, we had Scott Lieberman join because his mom had passed away from gallbladder cancer, and he was very dedicated to the mission. And he serves in our treasurer role. He had a finance background and currently serves in our treasurer role.
Okay.
But I'm looking to expand more board members who have been impacted by gallbladder cancer this year. And then I have a scientific and medical advisory board as well. So we have a series of experts ranging from like medical oncologists, surgical oncologists, epidemiologists who have a passion or focus on gallbladder cancer as well. So that's basically the team we have right now. We don't have very few volunteers right now, but we do have volunteers as well. But yeah, a lot of it's just kind of leveraging our volunteers, my board of directors, my SPAB, and trying to get as much work as I can. Actually, like surprisingly, AI has been pretty helpful as well. Like I hate dealing with social media, but that's one tool that's nice to just create a social media post for me and saves a lot of time.
That's great. Well, Sanjeev, you're doing good work, man. Hope you feel encouraged. I think you know putting wind in the sail is hard, but first you got to hoist the sail. You gotta build the sail. You got to get the boat going, and you've done a lot of work getting it rolling. So good work on that front.
Yeah, thank you.
For those people that are watching, and even for you, Sanjeev, our company, we host this podcast, but what we do as a company is we are a back office for nonprofit organizations. So, as other organizations that may watch this are saying, man, we're growing, our impact is growing, our fundraising is growing, but then we have to do social media and websites and accounting and donor database and receipts and 990s and all those things. Accordis is a team that we do that. We take that off people's plates. So, Sanjeev, you're doing great work, and I appreciate the work you're doing, and others will be impacted by you. So, thank you for leading, for caring for your mom, and even for the education you give me today on this conversation. This is fascinating, and I've learned a lot. And if anyone's looking to reach out to Sanjeev, we'll put the website to the Gallbladder Cancer Foundation, as well as the Citizen Health website, as well as the Accordis website on this final slot of this podcast today. Sanjeev, how should people reach out to you or get involved if they're interested?
Yeah, so the website's probably the easiest way. So right now, that contact form that gets emailed directly to me. So if you fill out the contact, that'll get sent directly to me. We have a volunteer sign up sheet as well if someone's interested in volunteering. But if I guess even just direct email wise, it's just sanjeevk@gallbladdercancer.org if anyone wants to reach out directly that way. But that's
Okay.
probably the easiest way is through the website or email.
Okay. Great. Thanks for your time today, Sanjeev, and everyone have a good day.
Yeah, thank you.